It was just a typical, beautiful Christmas day.
My family comes out. I've got 3 girls, and my mom comes out with her husband, just a small family, and we come out here and do lunch, open presents.
Just spend the day and have a good time and eat way too much.
Everything was fine. It was all good. And then my granddaughter, youngest granddaughter, asked Courtney to take her on the Razor to ride around the neighborhood.
I got the ATV out and went up. We usually just go up and down the street right here in this cul-de-sac. It's real safe and whatnot. And one of the younger children decided that she wanted to go for another ride, and of course Courtney volunteered to take her. And Courtney's an accomplished. She can ride motorcycles. She's driven these ATVs up in the mountains of Colorado at 12,000 feet of sheer edge cliffs and whatever. So it's not like it was her first rodeo. She'd ridden and driven these things quite a bit.
Then I went back inside to help clean up the kitchen, and my middle daughter came in, and I could tell by the look on her face. Sorry. As soon as she came in that kitchen, I knew something was wrong.
The next thing we knew, or I knew, my middle daughter and her husband were jumping up and just racing out the front door. And then Courtney's husband was doing, and I'm going, what's going on? They said they've had a wreck in the Razor.
And Sophie had just gotten a phone for Christmas. And I told Jonathan, my husband, I said, call her right now. And before he could call, she had called him and was screaming, come find me, come find me. Dee Dee can't get up.
So when I arrived on the scene, there was already some neighbors that had lifted the ATV off her arms, and they had gotten her in the sitting position, but she was still kind of in the cab, but it was on its side.
And when I saw Courtney, I thought, it's okay, it's good. You've broken your arm. I thought it was a fracture.
And I just kept, waiting to hear, why do we not hear sirens? Why isn't somebody coming, And so I took the phone away from him, and I said, I don't think you understand how serious this is. Like, we might need care flight here, because you couldn't see her arm.
Ambulance came and loaded me up. And I heard one of the paramedics say, where are we taking her? And the other one said, we're going to JPS.
And I thought, why are they going to JPS? Why are they taking Courtney to JPS? I was going, oh my gosh, I don't want to go there.
I just had the thought, I think that a lot of people may have, is it's a county hospital. And you get this idea in your head of what a county hospital is.
Well, I think because I'd always heard if you don't have insurance, and I even told the EMT she has insurance, and he said, no, we're going there because it's a trauma 1. After learning all that I did with other hospitals, if Courtney hadn't gone to JPS, I don't think she would be with us today.
Being a level 1 trauma center, we all know that when things are at their worst, this is the place you're going to go in Tarrant County. So I was just as interested myself in seeing how things worked from the inside, a place that we never get to see. So when Courtney came through the door, the very first thing I saw was what some have described as kind of organized chaos. If you don't work in the system, I think it looks chaotic. But what I saw was this wonderful, frenetic, yet completely balanced dance. I discovered what I had never known, that there is a path of communication that works in the room, in the moment, when everything is breaking loose and somebody's life is on the line. There is a flow of communication that's already established. And these professionals work on this day in and day out. This is far better than anything I think I even ever imagined, as far as the level of care, how they did their jobs, the technical aspect of it, and the speed and efficiency at which they worked. Courtney Etter came through the door. She was bleeding badly, and she was in the OR in less than 5 minutes.
The whole time I was there, the people from, food services to housekeeping to my trauma surgeon, I can't describe how good they were. Everybody was so good to me and my family. Everybody.
The nurses there were almost like family members. One of the nurses, the first couple nights, I know, was still picking out gravel from Courtney's hair and was just trying to help us brush it. I mean, they were unbelievable there. I mean, it trickled all the way down to housekeeping, how unbelievable the staff at JPS is. One of the doctors that Courtney had, her name was Dr. Kane, and she was the one that came in and told us that they were gonna have to amputate Courtney's arm. And just the compassion that she had when she told us, it didn't make everything better, but it made it okay.
And I vaguely remember asking my mom, what are they gonna do? Are they gonna take my arm? And she wouldn't tell me. And I remember telling her, you don't have to tell me, I know what's gonna happen. My doctor who was gonna release me came in that day and talked to me, and I was mad. And he looked at me and he said, you're not gonna let this injury define you. And that stayed with me. And I thought, I'm not. It may look weird, but I'm still Courtney. It's still me.
I don't think our outcome would have been the same if we not a knock on any other hospital or organization, but without the expertise that we found at JPS, I think we'd have a different outcome.
We get asked sometimes why, if I don't use the services of John Peter Smith or JPS, why do I need to give or support it? And sometimes you may not think you need it now because you have a healthcare provider somewhere else, you have insurance, you don't really think you need the services. But there could be an instance that you didn't plan. You may need JPS and what JPS provides at that moment.
JPS is so much more than just a provider of health care for the indigent. We have a level 1 trauma center here. It's the only one in the county. Our comment to anyone who asks, and even when they don't ask, we tell them, if you're involved in a serious accident, you need to go to one place and one place only, and that's the trauma center at JPS.
Let's face it, county hospital doesn't always have the best reputation across the country. I think your opinion changes the instant you get to see how things work. The moment you get to see the level of dedication from these people who live in our communities and do this work day in and day out, and it's thankless work in a lot of ways. When you see a life hanging in the balance, and then a few weeks later you get to see that person back to living a life.
I'm not going anywhere else. My husband's not going anywhere else. My family's not going anywhere else.
I think people need to know that they've got the best of the best at JPS.
I'll never be able to repay everybody who took care of me. I could go, 20 lifetimes. I couldn't repay them. Everybody.